Welcome to this video on Fluids and Electrolytes, course NUR 102. The learning outcomes for this video include identifying risk factors and clinical courses of fluid and electrolyte imbalances. We will also discuss the role of the LPN in the nursing process, diagnostic tests, pharmacological management, and patient safety goals related to these imbalances. This mind map illustrates the broad range of topics we'll cover, including distribution, function, assessment, diagnosis, and clinical management of fluid and electrolyte issues. Risk factors for fluid, electrolyte, and acid-base imbalances fall into several categories: chronic diseases like COPD and heart failure, acute conditions such as trauma and surgery, medications like diuretics, treatments such as chemotherapy and mechanical ventilation, and other factors like age. Fluid volume deficit involves a decrease in intravascular, interstitial, or intracellular fluids, leading to dehydration and isotonic loss. Management includes correcting the underlying causes and administering oral or IV fluids. Fluid volume excess involves too much fluid in the extracellular compartment. Management includes diuretics and fluid and sodium restrictions. We will focus on three main types of diuretics. Loop diuretics inhibit electrolyte reabsorption in the loop of Henle. Thiazide diuretics act on the distal tubule. Potassium-sparing diuretics compete with aldosterone at receptor sites, retaining potassium and phosphate. The normal range for calcium is 9 to 10.5 milligrams per deciliter. Hypocalcemia signs and symptoms include paresthesias, tetany, and cardiac dysrhythmias. Hypercalcemia can cause anorexia, muscle weakness, and cardiac arrest. Nursing interventions include dietary counseling and monitoring. Calcium imbalances have cardiac implications. Hypercalcemia is shown by a short ST segment and wide T wave. Hypocalcemia presents with a prolonged ST and QT interval. The normal range for magnesium is 1.3 to 2.1 MEQL. Hypomagnesemia signs include hyperactive reflexes, seizures, and cardiac dysrhythmias. Hypermagnesemia presents with hypotension, muscle weakness, and respiratory depression. Nursing interventions involve dietary advice, fluid monitoring, and administering prescribed medications. The cardiac implications of magnesium imbalance include a depressed ST segment and peaked T wave in hypomagnesemia. Hypermagnesemia can lead to a prolonged PR interval and a widened QRS complex. The normal range for potassium is 3.5 to 5.0 MEQL. Hypokalemia signs include abdominal pain, muscle weakness, and cardiac dysrhythmias. Hyperkalemia can cause muscle weakness, fatigue, and ECG changes. Nursing interventions focus on dietary management, fluid intake, and medication administration. Potassium imbalances show distinct cardiac implications. Hypokalemia can cause T-wave inversion or flattening, and a prominent U-wave. Hyperkalemia is often characterized by tall, peaked T-waves and a widened QRS. The normal range for sodium is 135 to 145 MEQ/L. Hyponatremia involves CNS and neuromuscular changes, leading to confusion and decreased BP. Hypernatremia can cause intense thirst, confusion, seizures, and low-grade fever. Interventions include fluid restriction or replacement, sodium restriction, and careful monitoring. The normal range for phosphate is 3.0 to 4.5 milligrams per deciliter. Hypophosphatemia can lead to confusion, seizures, and chronic states like rickets. Hyperphosphatemia symptoms include anorexia and vomiting. Nursing interventions include assessing for underlying causes and monitoring vital signs and electrolyte levels.